Hey guys, Nurse Muffin here again, trying to make the world a better place by preventing you from being a crappy nurse. So today, I'm not in my man cave, obviously, but I did want to get another video out to you guys. It's been a busy couple of days, and my sister had asked me if we could do a video on intro to cardiac. So that's what I want to go over today. We'll talk about the structures of the heart, the blood flow through the heart, and then a little bit about the electrical conductivity of the heart itself. And let's go ahead and dive right into that right now, okay, guys? Okay, guys, let's do a quick run through of the heart and the structures and how the blood flows through, okay? So I want to start off here talking about the vena cava. The superior vena cava brings deoxygenated blood in from the top of the body above the heart. The inferior vena cava brings it from down below the heart. Okay, this is blood that has been used by the body, by the cells already, and the oxygen has been extracted. So this is returning back to the heart to get re-oxygenated and to be pumped back to those body parts. So this is our right atrium right here. Keep in mind we're looking at a reverse image here, guys. So the blood is going to return here from the vena cava into this right atrium. When this right atrium contracts, it is going to push blood down here and into the ventricles, okay? When the blood gets there, the atria is going to relax and start to fill with blood again from the vena cava. When that happens, the ventricles are then going to contract, and they are going to push the blood up against the tricuspid valve here. That's going to cause these flaps to close and prevent the blood from backflowing into the atria, and instead it will flow towards the lungs by way of the pulmonary artery. When that blood is pushed to the lungs by way of the pulmonary artery, it goes to the lungs and gets reoxygenated. It's important to remember here, guys, that the pulmonary artery has deoxygenated blood. It is the only artery that has deoxygenated blood. Arteries are blood vessels that go away from the heart. Now, this is in fact going away from the heart. It does not yet have oxygen. When it gets to the lungs and gets oxygenated, it then returns back to the heart by way of the pulmonary veins. And again, veins typically have deoxygenated blood, but in this case, the pulmonary veins have oxygenated blood. They are going to the heart, so they are veins, but they are carrying oxygen-rich blood back to the heart in order to be transported to the body. So, and again, this isn't a normal sinus rhythm, guys. This is in a healthy heart. So as the atria are relaxing, they are filling again with blood. On the left atrium, it's blood that's coming back from the lungs after receiving some oxygen. As that atrium contracts, it's going to push blood down to the ventricles, right? Does the same thing on the left side as it did on the right side. So as that happens, the atria at the end of their contraction will begin to relax and fill with blood again. While they're relaxing, the ventricles will contract and push the blood out. We have a mitral valve here on the left side. That is going to be force closed by the pressure of the contraction. It'll push these valves together so that blood cannot backflow into the atrium again, and it will force this blood out into the aorta, and that delivers blood to the rest of the body. Okay, this contraction of the left ventricle is extremely important because this is the blood that is being delivered to the entire body, oxygenated blood here, guys. Okay, now you'll notice here that there is also an aortic valve to prevent backflow of blood. That helps increase what we call cardiac output. What we're looking at here is how much blood we're able to get to our tissues, our muscles, our organs, our brain. And that, that's the whole purpose of this here, guys. Now, keep in mind, this is in a normal sinus rhythm, healthy heart. We can get into things further down the road about things that can go wrong with this and what those disease processes look like, with some valvular issues or atrial fibrillation. But those are going to be topics we're going to have to delve into individually, and we'll talk about at a later date. So now that you guys understand the mechanics and the blood flow through the heart, let's talk about the electrical impulses that drive the entire process, okay? So don't mind my crude drawing of a heart here, but we have our 4 chambers, 2 atrium, and 2 ventricles like we talked about before, okay? So the first part of the pumping of the heart that we had talked about was the contraction of the atrium, okay? That impulse is generated from the SA node, okay? There's a node right about here in the right atrium that's going to signal the atrium of the heart to contract, okay? So that signal is going to go through, spread throughout the atrium, and tell them to contract. So give me a little pit stop here at what we call the AV node. So here, SA node, AV node, okay? So as the atrium are contracting, that signal goes to the AV node, and that begins ventricular contraction from there. So that signal goes down and tells those muscle fibers in the ventricles to go ahead and start contracting. Impulse comes down here through the ventricles, causing full contraction, okay? Now, what this looks like on your EKG, and again, for normal sinus rhythm, is we have what we call a P wave. That's the impulse that starts at our SA node and causes atrial contraction. Then we have our QRS complex. That is the electrical current causing our ventricular contraction. And then what we'll have is a T wave. That is the repolarization of those ventricles, getting them ready again to take another charge and go through another contraction. Now, the atria also go through this process, a repolarization process. The waveform of that, however, is lost within this QRS complex. This ventricular contraction is such a stronger complex that it hides that repolarization of the atrium, okay? So again, just to run through what happens in our heart, we get a signal from the SA node, causes those atria to contract, pushes the blood down into the ventricles. We have those valves that prevent blood from going the wrong way, so they just go down to the ventricles. As those atria are relaxing to refill, our ventricles contract during this QRS complex and push blood. The right ventricle will push it to the lungs to get oxygen. Left ventricle is pushing blood up the aorta and to the body to bring oxygen-rich blood to the body, okay? And then we have a repolarization, or a kind of a refresh for the whole electrical process to start over again. So I thank you guys for watching. I had a lot of fun with this video. Please comment down below if you liked it, anything we can do different, and I need a lot more ideas. Thanks, Sis, for giving me the idea for Intro to Cardiology, but I need a lot more, okay? Thanks, guys.